Hello students, I am Dr. Nidhi Gupta. I am a faculty at Center for Population Health and Development at the School of Development Studies at Tata Institute of Social Sciences, Mumbai. I welcome you to the module on Patterns of Sexually Transmitted Infections in India, which is a part of Population and Health paper. The main objective of this module is to highlight the types of sexually transmitted infections in India, the changing terminologies and changing patterns of STIs over time, and emergence of new forms of STIs like HIV. The module will also enable you to understand the sequel of STIs and how understanding of patterns of STIs can be helpful in its prevention and control at individual level, at community level, and at population level. Students will also gain an understanding about the prevention and control of STIs. Sexually transmitted infections or STIs are communicable infections that spread primarily through person-to-person sexual contact. There are more than 30 different types of STIs that may be transmitted by bacteria, viruses, and parasites. Several STIs, in particular HIV and syphilis, can also be transmitted from mother to child during pregnancy and childbirth, and through blood products and tissue transfer. STIs are a major global cause of acute illness, infertility, long-term disability, and death, with serious medical and psychological consequences of millions of men, women, and infants. Now let us look at the historical aspects of STIs. STIs are perhaps as old as human civilization itself. Medical descriptions of STIs date back to the 15th centuries when syphilis and gonorrhea were primarily responsible for the abandonment of public baths in Europe. STIs are among the most commonly diagnosed infections in many parts of the world. More than 1 million people acquire HIV or other STIs every day, and there are 450 million new cases of curable STIs occurring in adults each year. Now let us look at the epidemiology of some of the common types of STIs. RTIs is a broad term that includes STIs as well as other infections of reproductive tract infection that are not transmitted through sexual intercourse. Most STIs present in the form of 5 syndromes, that is, urethral discharge, genital ulcers, vaginal discharge, swollen glands, and lower abdominal pain. Some of the most common types of bacterial STIs are syphilis, gonorrhea, chlamydial infections, chancroid, and bacterial vaginosis. While genital herpes, HPV, that is human papilloma virus infection, hepatitis B virus infection, hepatitis C virus infection are some common types of viral STIs in addition to HIV and AIDS. STIs may be classified according to the agents that spread it. For example, if we look at bacteria, some of the common organisms that spread STIs are Neisseria gonorrhea, Chlamydia trichomoniasis, then Papilloma pallidum, etc. If you look at some of the viral agents, then some of the viral agents are human herpes virus 1, human herpes virus 2, which is herpes simplex virus, human herpes virus 5, which is also called cytomegalovirus, hepatitis B virus, human papilloma virus, HIV, etc. Some of the protozoal agents are Enterobacteria histolytica, Giardia lamblia, and Trichomonas vaginalis. Some of the protozoal agents are Entamoeba histolytica, Giardia lambalis, Trichomonas vaginalis, fungal agents like Candida albicans, and some of the ectoparasites also spread STIs. The epidemiological profile of STIs is more dynamic than that of other diseases. STIs differ from other diseases in the following aspects. Their incubation periods are highly variable. The genetic structure of most sexually transmitted pathogens are so diverse that researchers have been unable to design a vaccine against them. and these diseases are primarily spread by a behavior that is inherently resistant to change because it is highly motivated and varies considerably within and between social and ethnic groups. Their epidemiological profile varies from country to country and from one region to another within a country, depending upon ethnographic, demographic, socioeconomic, and health factors. The clinical pattern is also a result of interaction among pathogens, the behaviors that transmit them, and the effectiveness of prevention and control interventions. Now let us look at some of these diseases in detail. Syphilis. Syphilis continues to be a major health problem in India, though there has been a gradual decline in its prevalence. Few studies from northern part of the country like Chandigarh, Patiala, Rohtak, etc. show considerable decline of syphilis. Similarly, considerable decline in neurosyphilis as well as cardiovascular syphilis over the last 3 decades has also been reported. Serological surveys continue to be the best source of information on the prevalence of syphilis. During 2013, about 33,570 cases of syphilis were reported in country with 1 death. Syphilis in pregnancy leads to about 3 lakh fetal and neonatal deaths approximately every year and leaves about 2,15,000 infants at an increased risk of dying from prematurity, low birth weight, or congenital diseases. Gonorrhea. The importance of this disease is not only limited to its high incidence and acute manifestations, but also extends to the complications and disturbing sequelae. It is also an important risk factor for transmission of HIV infection. Information on the morbidity of gonorrhea is lacking as most cases go unreported. The general impression is that gonorrhea is more widely prevalent than syphilis. During 2013, about 97,000 cases of gonorrhea were reported in the country. Gonorrhea is one of the major concerns of pelvic inflammatory diseases, adverse pregnancy outcomes, and infertility. Trichomoniasis. This parasitic infection leads to vaginitis and vaginal discharge among women. Usually, there are no symptoms. In most men, there are no symptoms, but it may cause urethritis. Lymphogranuloma venereum, also called as LGV. It is commonly present with swelling of lymph nodes in the groins, and this disease, if untreated, may cause extensive lymphatic damage resulting in elephantiasis of the genitalia. It is reported to be more prevalent in the southern states of India like Tamil Nadu, Andhra Pradesh, Maharashtra and Karnataka than in the northern states. Human papilloma virus, also known as HPV. HPV is one of the most deadly STI. Virtually all cervical cancer cases are linked to genital infection with this virus. HPV causes about 5,30,000 cases of cervical cancer and about 2,75,000 cases of cervical deaths every year. Cancers of cervix is the second most common cancers among women with about 5 lakh new cases and 2,50,000 deaths each year. The new vaccine that prevents this infection could reduce these cervical cancers related deaths. HIV and AIDS. The data on HIV prevalence and future statistical projections shows signs of stabilization of HIV epidemic in India at national level. Provisional estimates for the year 2012 show that there were 20.89 lakh people living with HIV/AIDS with estimated adult HIV prevalence of 0.27%. Declining trends are noted in high prevalence states, indicating that the ongoing interventions and programs had favorable impact on health outcomes and control of HIV. Even the prevalence among pregnant women in the age group of 15 to 24, which is considered proxy for incidence or new infections in general population, is showing a declining trend. The epidemic of HIV shifts from the highest risk group, that is, the commercial sex workers, homosexual men, drug users, etc., to the bridge population, that is, the clients of sex workers, STD patients, migrant population, population in conflict areas, and partners of drug users, and then it shifts towards the general population. The shift usually occurs where the prevalence in the first group reaches 5%. There is a time lag of 2 to 3 years between the shift from one group to the next. Now let us look at the estimates of sexually transmitted infections. Data on STIs is often limited as STIs are often asymptomatic and often expensive to diagnose, hence true prevalence of STIs will never be known. This is particularly true in developing country contexts where there is limited or no access to healthcare facilities or limited access to diagnosis and treatment of STIs, or regions where social stigma is attached to STIs. Hence, due to the lack of adequate data, STIs in developing countries are substantially underestimated. The data on estimation of STIs is usually derived from surveillance systems or epidemiological surveys. In India, most of the data on STIs is available from institution-based studies, and very few community-based studies to provide prevalence is available, except for a few studies on high-risk groups like commercial sex workers, truck drivers, drug abusers, and hotel workers, etc. More than 1 million people acquire a sexually transmitted infection every day. Each year, an estimated 500 million people acquire one of the 4 STIs, that is, chlamydia, gonorrhea, syphilis, and trichomoniasis. More than 530 million people are living with HSV2 that causes genital herpes. More than 290 million women have human papilloma virus infection, which is one of the most common STI. According to the World Health Organization estimates, there are over 340 million new cases of 4 major curable STIs each year. That includes about 170 million cases of trichomoniasis, 89 million cases of chlamydia, 62 million cases of gonorrhea, and 12 million cases of syphilis, and 7 million cases of chancroid. Of these 340 million new cases, 150 million cases were reported from South and Southern Asia, including 50 million from India. Now let us look at the pattern of STIs in India. During the past few decades, STIs have undergone a dramatic transformation. First, the change in the name from venereal diseases, that is VD, to sexually transmitted diseases, that is STD, and then to sexually transmitted infection, which indicates a big transformation. In India, bacterial infections such as syphilis, chancroid, and gonorrhea were major STIs during the late 20th century, that is, between 1960s to 1970s. Viral diseases such as herpes simplex and human papilloma virus infections were extremely rare. The prevalence of bacterial STIs is decreasing while that of chlamydial and viral infections is increasing. The decline in bacterial infections may be attributed to the indiscriminate and prophylactic use of over-the-counter broad-spectrum antibiotics, upgradation of health facilities at the primary level, and greater awareness about AIDS. Social factors such as separation from home at an early age in search of job opportunities in big cities, lower level of education, sex at early age, premarital sex, multiple sexual partners, and frequent visits to commercial sex workers have led to relatively high prevalence of viral STIs. The spread of human HIV with subsequent behavioral changes since the 1980s has resulted in significant alteration in epidemiological patterns. As in developed countries, there has been a significant rise in viral diseases and a relative fall in the incidence of traditional infections. The high prevalence of HIV among the reproductive age group, that is 15 to 49 years, indicates that HIV continues to threaten people in their prime years of working life. 38% of infected persons in India are women. The female-male ratio of infected persons shifted from 55 females per 100 males in 2001 to 60 females per 100 males in 2005. This indicates the increasing feminization of HIV and AIDS in India, suggesting increasing awareness among women should be targeted. Now let us look at the determinants of STIs. Social or economic conditions and some sexual behaviors increase a person's vulnerability to STIs. Populations most at risk for STIs vary from setting to setting, depending on the local culture and their practices. Interventions to prevent and care for STIs should be intensified for such populations. Services must minimize stigmatization and discrimination. Now let us look at the determinants at macro level. Factors like socioeconomic factors, poverty, gender inequality, social factors like social disruption, international travel, urbanization, and industrialization and alcoholism are some of the socioeconomic factors that play an important role. Cultural factors like health-seeking behaviors and silence on sexual issues are important factors. Epidemiological factors like prevalence of STIs in a particular context. Demographic factors like population age structure, the sex ratio, and political commitment also plays an important role at macro level. At micro level, factors like biological, hormonal, immunological, and behavioral factors play an important role in determining the STI epidemic. Biological factors like gender, age, marital status, and infection from other STIs. Hormonal factors like use of hormonal contraceptives. Behavioral factors like age at coital debut, multiple sex partners, anal sex, sex during menstruation, vaginal douching, etc. play an important role. Now let us look at the complications and sequelae of STIs. As most of the STIs remain undiagnosed, people face serious consequences due to untreated or inadequately treated STIs. Some of the common complications are as follows. PID, that is, the pelvic inflammatory diseases, can be caused by chlamydia, gonorrhea, or bacterial vaginosis. Associated organisms, which has long been recognized as major cause of morbidity and mortality among women in developing countries, and has been associated with severe long-term sequelae such as infertility, ectopic pregnancy, and chronic pelvic pain. If untreated, it may lead to ectopic pregnancy in women planning pregnancies. In cases of PID, if it is left untreated for long durations of time, the infection spreads to upper genital tract, which may consequently lead to infertility. There are various other complications of STIs. However, STIs are preventable if proper barrier methods like male and female condoms are used. It is one of the most effective methods of protection against STIs, including HIV infection. Although the female condom is effective and safe, it is not widely used in national programs because of its higher cost as compared to male condoms. The aim of the control programs for STDs is the prevention of ill health resulting from the above conditions through various interventions. STIs can be diagnosed clinically or by laboratory testing. Although the latter is more accurate, it is not feasible in many parts of the world. WHO and UNAIDS therefore recommend the adopting of syndromic diagnosis and treatment of STIs in resource-poor settings. These interventions may have a primary prevention focus, that is, the prevention of infection, a secondary prevention focus that means minimizing the adverse health effects of infection, or usually a combination of the two. The control of STDs may be considered under the following heads. Provisional estimates for the year 2012 shows that. Now let us see what can be done for prevention and control of STIs. Initial planning. This planning includes activities like problem identification, prioritizing, setting the objectives, and considering strategies to meet the set objectives. Intervention strategies is a commutation of case detection which includes screening, contact tracing, locating, investigating, and identifying the treated cases, and cluster testing. The patients are asked to name the other persons of either sex who move in the same socio-sexual environment. Case holding and treatment. Epidemiological treatment, personal prophylaxis, and health education for behavioral changes are some of the intervention strategies. Support components like STI clinics, improving access to laboratory services, strengthening primary health care and information system, and implementing social welfare measures. Monitoring and evaluation. Ongoing evaluation of the disease trends provides a more direct measure of program effectiveness and may be used to determine the appropriateness of the selected intervention strategies for a particular setting. To conclude, we can say that it has been observed that in India, the patterns of STIs has changed over time with decrease in the prevalence of bacterial STIs, while the prevalence of chlamydial and viral infections, including STIs like HIV, hepatitis A, B, and C, have increased over the last 20th century. However, now the HIV prevalence rates have reduced with an aggressive programmatic and behavioral change interventions. A correct understanding of the pattern of viral STIs prevailing in different geographical locations of our country is necessary for proper planning and implementation of control strategies. Thank you.